Good Shape, your weekly dose of health information on Deutsche Welle. Find out more about what's new in medical treatment, alternative medicine, as well as nutrition, wellness, and beauty. Medical professionals, therapists, and counselors are in our studio to offer their expert advice on In Good Shape.
My guest in the studio today researches ADHD and is an expert in treating it in children and adults. Psychiatrist Dr. Michael Koller. Thank you very much for joining us today.
My pleasure.
Dr. Koller, why is it that ADHD is being diagnosed in more and more children worldwide? Is it just us adults wanting our peace and quiet?
I don't think so, but I must confess that there is an increase in the numbers of total ADHD cases. I think that the sensitivity of our society has increased. There's a much more sensitivity for of our child and of the individual development of our child. On the other hand, the demands and the needs in our society has increased. We are very interested that our child will be very good, in school. So I think there are a bunch of different reasons to go into this field.
Mm-hmm. So you say the sensitivity has increased. We focus more on our children and their behavior. Mm-hmm. How, as a doctor and as a parent maybe, can you differentiate between sort of normal behavior and a child that has ADHD?
Mm-hmm. I think the first thing that I want to say that for the parents is don't be worried if your child has attention problems. Because, attention problems is a normal way of in the process of growing older, or, for example, impulsivity. You have to be a little bit cautious if the development persists, for example, at least for 6 months, and if you see problems not only in the school, but also with their friends or at home. So if there is continuous problems over a special sort of time, you have to be a little bit cautious and then perhaps go to a doctor or another therapeutic approach.
Mm-hmm. So children might be hyperactive and have problems focusing. How does ADHD show in adults?
It's different. The cognitive problems become more and more prominent in adults. We call it the so-called dysexecutive function syndrome. That means problems in what is important and what is not, what do I first, what secondly, is very important, so that adults have more or less problems in how to deal with certain problems and how to deal, with my day-to-day life. The impulsivity and especially the hyperactivity problems are diminished in adults. It's not as the problems that you have in childs.
Mm-hmm. So it's more that you have problems organizing your day-to-day life, that sort of thing?
Absolutely.
Mm-hmm.
Absolutely.
Right, let's speak a little bit about the causes of ADHD. Many parents might worry that, it's got to do with too much TV consumption or eating too much sugar. What do we know today about the causes? You've conducted a study about that yourself. What have you found out?
It's very complicated to give you a very good and correct answer on this field. I think everything can consider that if you look only TV and don't do anything other stuff, it's not very good for the development of a child. But we don't have any data that really said that TV consumption is bad and then you get ADHD. I think you have to do it, in a proper way. So there are different forms of causes, and the neurological disturbances are one very main cause. So we have problems, for example, in the part of the brain that is responsible for decision making, and therefore the child and especially the adults have problems to distinguish between what is important, what is not important, how should I do first, and so on.
Mm-hmm. Dr. Koller, who can benefit from neurofeedback, from sort of training your brain?
We don't know this exactly at this time point, but I think this method could have a very great future. The way of became active and dealing with his own problems could be extremely helpful into the future. So we will see, but I think it's a very good development.
Mm-hmm. Medications like Ritalin are used to treat many children with ADHD. From your point of view, what are the possibilities? What can you achieve with Ritalin, and what are the limitations, or where do you have to be careful?
Up to now, the medication approach is the standard therapeutical approach. I think it's very helpful. But you have to be a little bit cautious. Don't think that you could deal any problems with medication. And therefore, for example, we have to interrupt the medication therapy every 12 months to see, is it really necessary that we continue the medication therapy. But you have to take into account it's a mixture of different approaches into the adulthood, like psychotherapy, and into the childhood, like social therapy or ergotherapy. That means you need different approaches to make a good therapeutical approach.
Can you tell us a bit more about these other approaches that are being used beyond medication? You said in adults is psychotherapy. What form of psychotherapy is that?
It's so-called behavioral therapy, which means you have to deal with what are the problems and what are possibilities to manage these behavior problems. In the childhood, for example, the motoric pathway will be focused on, like you learn a little bit about special behaving in special impulsivity systems. You learn a little bit more about how to deal with impulsivity and how to deal with special problem situations.
If you have a friend or a relative that suffers from ADHD, maybe your niece or nephew, what can you do to support them?
First of all, take it seriously. Give him a little bit help and try to understand this problem, try to help him, like make a good structure, help him a little bit in how to deal with day-to-day problems. This could be extremely helpful.
And be supportive.
And be supportive.
Well, thank you for being supportive to us. Thanks for being here. Thanks for your time.
My pleasure.